Hey guys, today I'm going to talk about semaglutide or Ozempic versus Mounjaro or tirzepatide, and particularly in regards to weight loss. So the way I'm going to do this, I'm going to go over how each medication acts in different parts of your body, talk a little bit about side effects, and then what the research shows. So semaglutide is what we call a GLP-1 agonist. GLP stands for glucagon-like peptide. The GLP-1s act in different parts of the body. Mounjaro is what we call a dual agent. So it's a GLP-1 agonist. It also acts on another receptor called GIP, or also known as glucose-dependent insulin-tropic polypeptide. So starting with the pancreas, both of these medications have an impact on the pancreas. Essentially what both will do is enhance insulin release from the pancreas, meaning you will release more insulin in response to a meal as opposed to without it. Both GLP-1 and GIP do this. Another thing we'll do is decrease glucagon, which is a hormone in your body which will try to stimulate more glucose production. Now the difference between the two medications, GIP will act on the pancreas outside of mealtime. So GIP will try to increase your glucagon when your blood sugar is low or normal and decrease it when the blood sugar is elevated, even outside of mealtime. Both these medications have effect in the brain also, and that effect is to decrease hunger. It also, in the stomach, both of these medications will have impact primarily because of the GLP-1, and it is going to delay food leaving your stomach. So what essentially that does will increase your satiety, or it'll take less food for you to feel full. Now Mounjaro, which does have the GIP effect, it's going to do a few other things. So it is going to have the fat cell take up more fatty acids and more glucose, which has the effect of decreasing your triglycerides. Another thing it does is going to inhibit certain cells to go to that area, which essentially lead to decreased inflammation, fat tissue. Both these are similar medications, and the side effect profile is very similar. The side effect profile for both medications are related to the dose. Most common side effects are GI related. Nausea is probably the most common. Vomiting is possible. Diarrhea, constipation, bloating. These are all similar in both medications. The class of GLP-1 medications has been used for a long time, and though semaglutide is only approved a few years ago, this class of medication has been around for a while, since 2012. So we've got to see some safety on that. This Mounjaro is a new class of medication combining a GLP-1 and a GIP, so there is no long-term safety data yet. How do they compare to each other in regards to weight loss? There are studies that they actually compared one versus the other. In those trials, Mounjaro definitely had higher weight loss. That said, they weren't necessarily equivalent doses, so they picked only one dose of semaglutide to go with versus 3 different doses of Mounjaro. That said, looking at multiple trials, on average, semaglutide people will lose up to 15% of their body weight compared to Mounjaro about 21%. So it was more effective overall in attributing weight loss, both in terms of total weight loss as well as percentage of people who got a result. Well, if you found that helpful, please like this video. If you want to learn more about other weight loss medications, check out one of these videos.